Hey guys, how you doing? I'm Luther.
And I'm Lizzie, and today we're going to talk about concussions. It is quite the hot topic, and it's something that really needs to be addressed because there's a lot of old thoughts and myths out there about concussions. So, first thing I hear about concussions is you should be in a dark room for however many days, 3-4 days, and you also should be waking up that person every 3 hours at night after they've had a concussion. However, that is not the case anymore, and the research has shown that you can progress into stimulation as far as schoolwork, actual work, phones, all that kind of stuff, and you don't need to be waking up that person. Let them get their sleep and let their brain rest. So what we're going to do today is we're going to show you a few exercises that you want to start out with if you have had a concussion, and these are ones that are going to help you get back into whatever it was that you were doing before, whether that be sport, work, whatever it is. These are the ones you want to start with. So what we're going to do is Luther is going to put up his thumb, and he is going to keep his eyes on his thumb, and he is going to tilt his head down about 30 degrees, and then he's going to shake his head side to side, keeping his eyes glued to his thumbnail. And the goal is to be able to do just like that. The goal is to be able to do 120 beats per minute for about 30 seconds. Go ahead and stop. So once you start to feel your symptoms come on, that's when you need to stop and take a break, and then you get right back into it and do 3 to 5 sets of those at a time. The next one is called saccades. So he's going to put his hands out straight in front of him. He's going to keep his head super still, and he's going to look from fingernail to fingernail as quickly as he can. So what this is challenging is if you're reading a book or you're scanning a page or scrolling through your phone on Instagram, YouTube, whatever it may be. Yeah, you can go ahead and stop. That's how your eyes move super quick. And so concussions will really affect that type of movement in your eye. So this is a great one to help retrain that. And again, you want to just do 3 to 5 sets of that, going right up to your symptoms and then taking a break. The last one is going to be, we're going to challenge your vestibular system, so your balance and proprioception and where you're at in space. So he's going to stand on this surface, which it's a foam pad, so it's going to make it an unsteady surface. And what he's going to do is he's going to look at a target in front of him, and then he's going to turn his head quickly to the left and then back forward, and then quickly to the right and back forward. So he's just going to keep going back and forth as quick as he can. And he is going to make sure that his point that he's looking at is not blurry when he looks back. Good job. All right, you can take a break. Go ahead and step off there. So all of these you can really increase the challenge. VOR you can do on an unsteady surface. You can do it walking. You can do it with different activities. Same with the saccades and the head turns here. So all these can really be increased in challenge, and it's something that you should be doing, especially if you're getting back to sport.
Also with reactive, it's good reaction timing. I recommend people use it for timing. Any guys, but this is as you heard, Lizzie, this is very good, especially for football guys. Football guys, you guys may get a concussion or have concussion-like syndrome symptoms, and you just don't know. And these 3 basic exercises can help you improve that, or it can tell you where you're at. And I recommend you guys use these for sure, especially taking abuse you guys take every game.
Exactly, yeah. So take it easy on these, don't get too crazy, but definitely give them a shot and seek out a professional who is trained with concussions if you have had one, just so you can be on the correct plan of care. All right, so in this video you saw concussions and different things you can try immediately after you've had a concussion. Again, I want to reiterate that it is super important to seek someone like myself who is a specialist in concussion care, and so you can get on the right path and get you better quicker, and also back on the field or back into work as soon as possible.
I'm Luther.
And I'm Lizzie, and stay tuned for our next videos.